procession is led by the Dean of the College of Nursing, Dr. Victoria Niederhauser, and the Interim Provost of the University of Tennessee, Knoxville, Dr. John Zomchik.
Our second speaker is Tim Holt. Tim is graduating with the Doctor of Nursing Practice degree with a clinical focus in the psychiatric, mental health, nurse practitioner concentration. Mr. Holt is a member of the Sigma Theta Tau International Nursing Honor Society Gamma Chi chapter, the American Psychiatric Nurses Association, and the Georgia Board of Nursing. He is employed at Piedmont Health Systems in Evans, Georgia, as a registered nurse and clinical nurse educator. Please join me in welcoming Mr. Holt to the podium.
Thank you. I heard when they said the word psych, all these people went, oh my gosh. You know, I get kind of used to that when I work in a non-psychiatric hospital, and when they find out you're psych, it's like you walk down the hallway and the seas part. And you know, everybody kind of runs for the hill. And I got used to answering the question, why? You know, so it's definitely a passion. Thank you. Happy Nurses Week to everybody. So congratulations to making your journey this milestone. I'd like to talk to you today a little bit different. Mackenzie's kind of a hard act to follow. So I'd like to talk to you today about mistakes and miracles. First, let me frame the speech by saying, within the past few months, during interviews, one of the first questions I get asked is not whether I know how to diagnose, prescribe, or if I know a particular technical skill. I was asked, if put in a difficult circumstance, whether I would stand up to a provider, a director, a peer, and say, stop, no, or I disagree. At first, this question was surprising until I really dug in to the meaning and discovered that interviewers were judging me whether I had what it takes to do on a micro level what is right for the patient, the student, or the individuals participating in a clinical trial, and on a macro level, whether I will be a leader who will affect and promote quality change. I'd like to give you a better understanding on why the interviewers were so keen on the topic of courage. An article in the Journal of Advanced Nursing stated that during a crisis, 9 out of 10 nurses would stay quiet and say nothing. This is a shocking statistic. We are not a profession who stands in the shadows of others because of titles and letters behind their names. So I ask you, then why do nurses stay quiet during a crisis? Research has affirmed that nurses, regardless of educational status, have a level of fear in offending someone or feel fearful of the repercussions of standing up or taking action. This is where I bring in the topic of mistakes. From my experiences in bachelor's, master's, and doctoral level nursing curricula, the word mistake is directly related to leadership. In the high-pressure environment of healthcare, whether it's bedside, academia, clinical practice, a mistake is an action that is often considered taboo, but in reality, it does occur. Look at any statistic out there, and you will find that mistakes, specifically in healthcare, do occur. As hard as it may be to accept at times, we are all human and we will make mistakes. I have made mistakes both personally and professionally, some big and some small. Ask an individual who you respect the very most if they've ever made a mistake, and I feel confident they will say yes. This may shatter your perfect image of them, but the people I admire the most, personally and professionally, will tell you they have made mistakes and how those challenges made them who they are today. A wise friend once said, "Tim, if you're not making mistakes, you're probably not doing anything worthwhile." The Harvard University Business Review states that healthy and successful organizations, whether nonprofit institutions or for-profit practices, are ones that support these individuals who make mistakes. In my previous life, before nursing, I remember being asked whether I believe in miracles. To me, a miracle is not necessarily an event, but it is the people who did not run away or hide when I made a mistake. The miracles are the individuals who stayed, even when all seemed lost, and said, "What can we learn from this event? And I am human, therefore I have also made mistakes." They pick you up, dust off your knees, and push you to continue the race even when the short-term outcomes appear overwhelming. I often tell nurses, whether new to bedside, advanced practice, or to an organization, their first priority should be to establish professional relationships on the get-go. Nursing is hard. We have to take care of more patients as the hospital census grows, staffing decreases, and budgets are cut. These patients are sicker, their care is more complex, yet regardless of whether you are a bedside RN, a nurse leader, an advanced practitioner, an educator, a researcher, or a mix of all the above, most of the time you're working in an environment where the bar is set very high, yet the available resources are very low. No longer is nursing a one-person show. You will need help. To me, the most impactful nurses are those that develop their soft skills. I ask you, in reflection, do you have the personality that will build relationships with the employee who hands out the dinner trays at night, the administrative assistant who works in your practice or your academic department? I guarantee you, at some point, that relationship will determine an outcome. In a team, whether teaching courses in a nursing program, bedside in a rural hospital in Appalachia, or in a private practice, there is no member of the team that is more important than the other, period. Therefore, when the need arises in an interview, in a side conversation, or if you find yourself in a tense situation, will you stand up to a physician? Will you stand up to a manager, or maybe a peer? Can you find your courage and your voice even when you are under scrutiny and under pressure? Will you be that person who goes out on a limb and says stop when you observe professional bullying, or your post-surgical instrument count is off, or you witness a violation of a sterile field in an operating room, or in the emergency department you notice signs of abuse on a patient? You are a nurse, a citizen, a human being, and I charge you to say with confidence, yes, I will speak up, even when others turn away in fear of making a mistake. The new Chief Nursing Officer of our 7 hospital health system stated in the first paragraph of her introductory email, not references about her credentials or her experiences, but instead a statement, "I am human, and I learn from my mistakes." I challenge you to be a miracle for someone else, even when you want to run away and hide, and you see others that are. Step forward and say, what can we learn from this event? I am human, and I've also made mistakes, and push them to finish the race. In closing, I leave you with this. Humans are inquisitive and impressionable by nature. Our actions can be contagious, memorable, and impactful to others. Benjamin Franklin was reported as saying, the 3 hardest things in the world are 1, diamonds, 2, steel, and 3, knowing yourself. Remember that volunteers go first. Thank you and congratulations.
Yes.
Let's give both Mackenzie and Tim another round of applause. That takes